Health and happiness, seemingly trivial things you wish your family, friends and colleagues on January 1st. When thinking about health and disease, you'll probably think of elderly people with porous bones or leaking heart valves, but also psychological health determines a great deal of our quality of life and daily functioning, for young and old. Schizophrenia, Greek for split mind, is a psychiatric disease in which a patient is suffering from delusions or hallucinations, and symptoms like the inability to experience pleasure, focus or take initiative. Considering the serious character of the disease, hospitalization and stabilization via medication, therapy and rehabilitation are often unavoidable. Avoiding relapse is of crucial importance since relapse produces a huge, irreversible decline in quality of life. Hence, schizophrenia is a limiting disease, notorious for its revelation during adolescence. A time when you and your peers are busy shaping their life with education, a first job, relationships, a house and so on. In short, a period where there is much at stake. An extensive Trumbus study in 2012 on adolescents with schizophrenia showed that adolescents that just came out of a psychotic episode indicated they need goals for the future, a job, a house, a relationship and so on. However, on their way to achieving those goals, they face stigmas in their environment hindering the rehabilitation process. Additionally, their doctors tend to focus more on their disease and the prevention of relapse and seldom ask for their future plans. A lost opportunity, since a custom-made positive approach of rehabilitation would match the patient's need better. On top of that, a talents and goals-based positive approach has proven to be more effective than standard of care alternatives. This has been proven in other fields of mental health care, such as treatment of severe depressions. A positive approach would therefore act as a leverage point for quicker reintegration and a better quality of life. Talent Under Construction is an online platform based on techniques developed in positive psychology. It helps both the patient and the health professional to start a dialogue about the goals in life of these adolescents, explore their talents and integrate these with regular medical treatment in rehabilitation. The tool consists of different modules suitable for different phases in treatment and rehabilitation. In the first phase, talents and goals of the patients are being mapped by filling in different exercises and incorporating family, friends and colleagues by having them filling out assessments of the patient's top 5 talents. The result of this dialogue will then be an online bookshelf with all dreams, talents and future goals of the patient and will guide the rehabilitation process. The patient will manage the second phase of the rehabilitation via the platform. Central object is the patient path of life, an online visual roadmap of future goals, milestones to celebrate and pitfalls to avoid. Along the way towards the horizon, the patient will find handy tools suitable for the 4 domains of under construction: health, work and education, relationships and everyday planning. Examples of online tools could be information about the disease, sending push messages on taking medication to your smartphone or printed weekly planners. But also tips for job interviews, example resumes, Q&A expert forums, online social skill training and web-based tutorials. Also, there will be other innovative methods that help start a dialogue between the patient and their environment on their goals, talents and pitfalls to increase social support and decrease stigma. The implementation of this tool will take place in 2 phases. In the first pilot phase, only the first part of exploring talents and objectives in rehabilitation will be offered to mental health professionals. During this pilot phase, the second part can be further developed and the tool can be incorporated in regular medical follow-up as mode of entry. Now, let's take a look at the quantitative side of this. The total population of people suffering from schizophrenia is 32,000 and there are approximately 2,500 new patients per year. Estimates are that annually 2,000 of these new patients might benefit from the tool, whereas 1/4 of the existing population might profit from our tool as well, which makes 10,000 potential users initially, plus 2,000 every year. The total costs of mental health care for schizophrenia are estimated around 500 million euros per year, and these numbers are still growing. If we could reduce the recurrent rate of psychotic episodes, as well as replacing low complex counseling in person to the web, the total amount of treatment minutes can be lowered from, let's say, 12,500 minutes to 11,000 minutes. A difference of 25 hours that will result in a cost reduction of nearly 9,000 euros per patient. If only half of the new feasible patients meet this estimated improvement, this would result in an annual cost reduction of 10 million euros. Not to mention the macroeconomic gains of labor productivity. For the research and development for our tool, we expect to need 100,000 euros and 10,000 euros maintenance costs per year. Additional cost would be the training of professionals, marketing and communications, financing cost and overhead, although limited. Our initial cash flow would come from both government and patient association subsidies and investors, such as organizations operating in psychopharma, like Johnson & Johnson, our hosting company. After completing the first 2 years of research and development in the pilot settings, we aim to use the healthcare providers as a mode of entry and the insurance companies as financing partner to include into standards of care. Parties can be motivated by both qualitative arguments, such as the patient empowerment and inclusion, and quantitative arguments as cost reduction by prevention and substitution. With previously mentioned success rates, costs and a selling price per patient of around €500, this will result in a break-even point in year 3. In sum, we believe that this tool, while achieving significant cost reduction, has great potential in guiding young people effectively and sustainably into a normal life.